Hello.
Okay, good afternoon, students. Good afternoon. Welcome back. All right, now before we start, let's check the settings first, okay? Okay, now let's check the settings first. Can you see me? Yes or no? Can you see me? Can you see me? Okay. Can you hear me? Can you hear me? Yes or no? Can you hear me? Yes. All right. Now, let's begin our lesson. All right. Now, welcome back, students. Everything is fine. So let's begin our lesson. Welcome back. Good afternoon, students. So my name is Teacher MJ again, and I'm very, very happy to see you all again today. All right. Now, before we start, I would like to greet you all. Good day. And how are you today? How are you today? Are you good? Hmm? How are you today? Let's have organ. Oh, King Keo, you're fine. That's nice, King Keo. Very good. How about organ? Organ, how are you today?
I'm fine, thank you.
I'm fine, thank you. Teacher.
Okay. All right. Thank you. Very good, organ. How about Yim? Yim, how are you today? How are you today, Yim? Are you good? Are you fine? Are you happy today? Okay. Now, today we will be having a new lesson, okay? So our lesson for today is all about injuries and illnesses, okay? Now, let's review the vocabulary first. Repeat after me. Pudangdang, let's say injuries.
Injury.
And illnesses. Okay, very good, students. That's right. So today we will be talking about injuries and illnesses. So what do we mean with injuries and illnesses? Let's begin. Now, in this lesson, we will know about the illnesses that we have, the injuries and exercises. Okay, now are you ready? Are you ready? Are you ready? Okay, now let's begin. Now, here are the illnesses to know. All right. Now, look at this. Now, the knowledge of causes, symptoms, and preventions will help prevent illnesses. Now, common illnesses that you should know are as follows, okay? Now, illnesses are the symptom, okay? And the preventions that you have, okay? Now, illnesses is the one that you get from outside forces. Okay, when we say outside forces, from bacteria, from diseases, so these are the illnesses, or we call them illnesses. Okay, like colds or fever, so those are an examples of illnesses. Now let's have colds. Okay, now what do we mean with colds? Who wants to read? What do we mean with cold? Cold is cold is a communicable disease usually found in all genders and ages, okay? It mostly happens in rainy or winter season. Now, usually we experience colds, especially during winter, okay? Now, when we say winter, that is the cold weather, okay? When it's cold, okay? We experience cold. What do we mean with cold? Cold happens from the spread of virus through coughing. Okay, so those are an example of symptoms of cold. Also sneezing. When we say sneezing, that is, okay, when we have phlegm in our nose, so that is what we call sneezing, okay, or touching things from those who are already sick, okay. So that's why when someone in your family or when you have classmates or friends who has these symptoms, stay away from them because it can cause colds. Okay, one more time, repeat after me, pudangdang. Let's say colds.
Space moon. Cold.
Colds.
Cold.
Okay, again, colds spread through virus like coughing and sneezing, like and touching things who are, or for those people who are already sick, okay? That's why it is important that we should be able, or we should stay away from those people, okay?
โอเคนะคะโรคที่เราควรรู้นะคะก็คือโรคแรกนะคะ cold ก็คือโรคหวัดนั่นเองนะคะโรคหวัดนี้จะมาในฤดูอะไรคะส่วนใหญ่ฤดูฝนหรือฤดูหนาวนะคะอาการของโรคเป็นยังไงคะมีอาการไอจามบางคนอาจจะเจ็บคอสาเหตุเกิดจากอะไรคะการแพร่ของเชื้อไวรัสต่างๆหรือบางทีอาจจะติดจากคนที่เป็นแล้วก็ได้นะคะบางคนมีน้ำมูกไหลคอแห้งจะมีอาการไอจามปวดเมื่อยเนื้อตัวอาจจะเป็นไข้ก็มีนะคะนี่เรียกว่าโรคหวัดนะคะโคเด็กๆรบกวนปิดไมค์ก่อนนะคะถ้าที่ยังไม่ได้ให้เปิดเพราะว่าเสียงมันไม่ชัดค่ะ
Okay, now what are the symptoms that you will get or you will see when you have colds? Okay, now for the beginning, the typical symptoms of the cold include stuffy nose. Okay, when we say stuffy nose, you have inside in your nose, even if you don't have anything here, but you have phlegm. Okay, you have stuffy nose. Okay, you have runny nose, possible fever, dry throat, meaning your throat is dry, okay? When you swallow your saliva, it seems or it feels like your throat is dry and it's very rough, okay? And you have sore throat. When we say sore throat, your throat is sore, okay? It's painful. This one, it's painful. So that is one symptom of having colds, okay? Then you will experience cough, sneeze, and muscle ache. So your body is aching. You're not feeling well. May sabay, okay? And your nose and your throat is not good, okay? So that is one example of having cold. Now, this is an example for you. Look at this. So how do you treat, okay, so this one. So this is an example of colds, okay? Look at that. So look at the boy here. So this one, he has a cold, okay? So this is an example of colds, and this one as well. As you can see, the girl here, she's wearing a mask because she always cough and she has stuffy nose. That's why if you don't wear mask, you will get other people infected, okay? That's why if you have colds, you have to wear masks, okay?
การป้องกันนะคะถ้าเด็กๆเป็นหวัดหรือเวลาจะจามหรือไอให้ใช้มือปิดหรือผ้าก็ได้นะคะผ้ามาปิดปากนะคะหรือบางคนอาจจะสวมแมสแบบนี้ก็ได้นะคะเพื่อป้องกันการกระจายของเชื้อโรคนะคะในใครเคยเป็นหวัดเคยไหมคะเด็กๆทุกคนส่วนใหญ่เป็นหวัดนะคะเพราะว่าถ้าอากาศเปลี่ยนเราก็จะเป็นหวัดอากาศเย็นหรือว่าฝนตกอาจจะทำให้เราเป็นหวัดได้ง่ายๆนะคะเพราะฉะนั้นถ้าฝนตกเด็กๆไม่ควรออกจากบ้านนะคะ
Okay, now what are the treatment, okay, for colds? When we say treatment, you will treat it, okay? You will prevent it from spreading in your body. How do you use it? First is use a cloth soaking with warm water to clean your body when getting more sick. So what you want to do is you will take out a towel, okay? And then put the towel in a, make it warm and then do hot compress, okay? Put it in the parts of your body who are sick, okay? Next, take paracetamol for headache and take it every 4 to 6 hours if you do not feel better, okay? If you have colds and you're sneezing a lot and you're coughing, you can drink paracetamol, okay? Paracetamol is one way to actually make you feel better, okay? It makes you feel better and you take it every 4 to 6 hours. So basically that is 3 times a day, every 6 hours, okay? Okay, and lastly, of course, you have to drink a lot of water, okay? Nam, you should drink a lot of water and get enough rest, okay? When we say get enough rest, do not go anywhere, okay? Just stay at home and sleep, okay? Okay, do you like to sleep? Do you like to sleep? All of you, do you want to sleep? Do you like to sleep? Yes. Okay. Now, when you are sick, it is important that you should be able to have rest and you sleep tight. Okay? All right.
การดูแลรักษานะคะเมื่อเราเป็นหวัดนะคะหนึ่งเลยใช้ผ้าชุบน้ำอุ่นเช็ดตัวนะคะใช้ผ้าชุบน้ำอุ่นเช็ดตัวสองกินยาพาราเซตามอลนี่เด็กๆเคยได้ยินกินยาพาราเซตามอลถ้าเรามีอาการยังไม่ดีขึ้นหรือมีการปวดหัวกินได้ทุกๆ4 หรือ 6 ชั่วโมงนะคะอันที่3นะคะดื่มน้ำ warm water ก็คือดื่มน้ำอุ่นแล้วก็พักผ่อนให้เพียงพอนะคะ
Okay, now how do you prevent it from, how do you prevent colds from getting you? Okay, so this is how you will do so that you won't be able to catch cold, okay? Now, eat healthy food, kin pak, okay? Eat vegetables, okay? Eat healthy foods and exercise, exercise, okay? Exercise regularly and get enough rest, okay? When we say get enough rest, sleep early, okay? When it's already 9 p.m., you don't do video games anymore, okay? Sleep early and sleep long, okay? Sleep around 9 p.m. and then wake up around 7 a.m. or 8 a.m., okay? And then eat healthy foods like vegetables, fruits. Now, what vegetables do you like? What vegetables do you like? Let's have Bright. Right. What vegetables do you like?
Bright ชอบทานผักอะไรคะ
Carrot.
Carrots. Oh, I like carrots too. How about Yay Mai? Are you there?
Carrot.
Yay Mai, what vegetables do you like? Yay Mai. Kinpak alay. What vegetables do you like? Chop Mai. Pak.
Carrot.
Carrots. Oh, I like carrots too. Very good. How about Namo? Namo, what vegetables do you like? Namo, what vegetables do you like?
ชอบทานผักอะไรนะน้องนโม
Broccoli.
Broccoli. Oh, that's nice. Very good. So those are vegetables that you should be eating so that you can prevent colds from catching you. Okay. Next, do not come in contact or share things with those who are sick. So that is number 2, meaning do not go near sick people. Okay. If you saw your friend or your family who is sick and has cold, stay away from them, okay? Don't go near them, okay? Because you can catch the cold too, okay? And last is close your mouth and nose when sneezing and coughing to prevent a spread, okay? So students, it is important that when you Achoo. When you do that, you should cover your mouth. Okay? When you do achoo, achoo, you cover your mouth. Okay, like this. Achoo, achoo, achoo. Okay? Okay, again, cover your mouth when you are sneezing or when you are coughing, like cover your mouth. Okay, so that you will be able to prevent others from catching virus from you. Okay, and wear mask. Okay, if you are sick, if may sabay, you wear mask. Okay, even if you are inside the house, you wear mask. Okay.
ป้องกันที่จะไม่ให้เราเป็นหวัดนะคะ ข้อที่หนึ่งนะคะeat healthy food ก็คือรับประทานอาหารที่มีประโยชน์ทานผักดื่มนมนะคะ แล้วก็ออกกำลังกายอย่างสม่ำเสมอพักผ่อนให้เพียงพอเป็นเด็กเราควรนอนพักผ่อนอย่างน้อยวันละ8 ถึง 10 ชั่วโมงนะคะเป็นเด็กนะคะไม่ควรนอนดึกไม่เล่นเกมจนดึกนะคะพักผ่อนให้เพียงพอร่างกายเราจะได้แข็งแรงเมื่อแข็งแรงแล้วเราก็จะไม่เป็นหวัดนะคะข้อที่2ห้ามไปติดต่อหรือไปสัมผัสผู้ที่มีอาการป่วยหรือจามนะคะแล้วก็ไม่ใช้สิ่งของร่วมกันอย่างเช่นพวกผ้าเช็ดหน้าหรือผ้าเช็ดตัวต่างๆนะคะเราจะไม่ใช้ร่วมกันนะคะข้อที่3เวลาไอหรือเวลาที่เราอยากจามเมื่อที่เชื่อบอกเมื่อกี้เวลา เนี้ยเด็กๆต้องใช้มือปิดปากหรือใช้ผ้าก็ได้นะคะหรือใครที่มีอาการรุนแรงก็สวมแมสนะคะเพื่อป้องกันการแพร่กระจายของเชื้อโรคด้วยค่ะโอเคค่ะที่เชื่อ
Okay, now let's move on to pink eye. Okay, when we say pink eye, your eyes become red or pink. Okay, now how will you avoid that? Okay, now first you have to, what is pink eye first? Okay, pink eye is a communicable disease commonly found in school-age children. Okay. School-age children are you, okay? You are school-age children, okay? Now, it easily spreads due to lack of prevention. Now, what causes pink eye? Pink eye happens from a viral or bacterial infection causing conjunctival inflammation in the eye, okay? Repeat after me. Let's say, udang-dang, conjunctival. Okay, conjunctival meaning your eyes, the white of your eyes, look at that, this one, the white one in your eyes becomes pink, okay? It means it has conjunctival inflammation, okay? Now, it can also happen from a fruit fly that has contacted with an infected person and then it contacts others, okay? Now, if you have pink eye, it means that your eye is burning, okay? When we say burning, it's painful, okay? A patient will feel annoyed and have a tear, meaning there's water, okay, in your eyes, numb in your eyes, and gum in the eye will be bloodshot. So this is an example of a pink eye. This one, okay? Look at this. So this is an example of a pink eye, okay? So your eyes are sore and it's color pink, okay? This one, this is the normal eye. As you can see, this is the normal eye and this is the eye with infection, okay? We call this pink eye, okay? Okay, repeat after me. Let's review. Repeat after me. Let's say, Pudangdang, pink eye.
Pink eye. Pink
Okay,
eye.
pink eye. All right, so this is an example of a pink eye, okay? So we can call this sore eyes, okay? We can also call this sore eyes, okay? So how do we get pink eye?
น้องออร์แกนปิดไมค์ก่อนนะคะ
So how do we treat pink eye, okay? So pink eye, do not rub, okay? When we say rub like this, okay? Don't do it, okay? Don't do it like this one, okay? Don't do it, okay? Now, don't rub the eye when feeling irritated and having a tear in the eye, okay? Use clean cloth to rub it gently instead. So take a cloth or take a tissue paper, okay? Like this. So what you want to do is to take a clean tissue paper, okay? Tissue paper. Have this and then pat your eyes, okay? Don't rub, okay? Don't rub, do not rub, only pat your eye like this. Pat your eyes with clean cloth, okay? Okay, and if in case irritated, the eye, it is bloodshot. When we say bloodshot, it's color pink red, okay? It's like pink, but it has red. And quickly tell your parents to take you and see a doctor, okay? If you have bloodshot eyes, like pink eyes, what you wanna do is you do hot compress. So this is your cloth, this is clean, okay? Put hot water and then pat it in your eyes like this. Pat it, okay? Do not rub, don't rub, just pat like this. Pat it in your eye and then go to the doctor, okay? Okay, next, how do you prevent it from getting, how do you prevent yourself from getting a pink eye? Now, do not come into contact or share personal items with a person with eye infection, such as handkerchiefs or towels, okay? So what you want to do not borrow, okay? When we say borrow, don't ask for a person who has pink eye for their handkerchiefs, okay? And do not go near them, okay? Because pink eye is airborne, okay? Do not go near patients or person or people who have pink eye. In short, you stay at home, okay?
โรคที่สองนะคะ pink eye ก็คือโรคตาแดงนั่นเองนะคะ เป็นโรคที่เกิดได้กับเด็กๆในวัยเรียนนะคะ ส่วนมากก็คือเด็กๆอย่างเช่นเด็กๆนี่เองป.2 เนี้ยเป็นเพราะว่าเราถ้าสมมติเกิดเราไปโรงเรียนอย่างเงี้ยนะคะ ถ้ามี1 คนที่ติดเป็นตาแดงสาเหตุอาจจะมาได้จากหลายสาเหตุเชื้ออาจจะมีฝุ่นเข้าตาหรือบางทีแมลงวีเด็กๆรู้จักแมลงวีไหมคะตัวเล็กๆมันจะบินมาตอมที่ดวงตาถ้าใครเป็นตาแดงก่อนแล้วถ้าบินมาตอมตาคนนี้แล้วไปตอมอีกคนนึงก็จะเกิดการติดได้เพราะฉะนั้นถ้าเด็กๆเป็นแล้วอย่าใช้มือถูขยี้ตาแรงๆแบบนี้ไม่เอานะคะต้องใช้หาผ้าหรือกระดาษทิชชู่ที่สะอาดแล้วนำมาเช็ดเบาๆนะคะแต่ถ้าไม่ดีขึ้นหรือตาแดงจนเป็นแบบสีแดงจนเป็นเหมือนคล้ายๆเลือดแล้วเด็กๆต้องบอกผู้ใหญ่หรือแจ้งคุณครูให้ทราบเพื่อที่จะได้ไปหาหมอนะคะโอเค
Okay, again, this is an example of pink eye. Look at that. So do you want to have this? No, because this is very painful, okay? If you get this, you can't go to school, okay? So always stay at home and don't go near to people who have this, okay? So this is pink eye or conjunctivitis, okay? Okay, now let's move on to the third illness, okay? Let's have diarrhea, okay? Repeat after me. Let's say diarrhea.
Diarrhea.
Very nice. Udang-dang. Diarrhea.
Diarrhea.
Okay, now what do we mean with diarrhea? So diarrhea is an illness caused by eating, okay, unclean and contaminated food. It can happen to everyone, okay? So when you eat bad food, okay, bad food, it means not clean and contaminated, meaning it's already spoiled, okay? Spoiled food, you will get diarrhea, okay? So do not eat uncontaminated food and do not eat food that are spoiled, okay? When we say spoiled, you cannot eat it anymore, okay? It means it's not good, okay? Now, what are the causes of diarrhea? Now, the diarrhea is caused by an infection and by eating unclean or strong flavored food, such as very spicy and very sour food, okay? So if you are eating food that are very, very spicy and spoiled food or unclean food or contaminated food, you will likely get a diarrhea, okay? Now, having diarrhea means defecating more than 3 times a day. When we say defecating, you go to the toilet and, okay? Okay? It means you go to the toilet and you poop, okay? Okay? That's why if you go to the toilet 4, 5 times a day, it means you have diarrhea and your stomach, okay? Your stomach is very painful, okay? It's like, it's painful, okay? That's why, meaning you have diarrhea, okay? Now, it also includes having stomach ache, okay? If you have stomach ache, if your stomach is painful and you feel weak, okay? And sometimes you're throwing up like, "Ugh, ugh," okay, like that. It means you have diarrhea. Sometimes if you have diarrhea, you also have fever, okay? That's why you have to watch out for that, okay? Now, in case of losing too much water, it may lead to shock, unconscious, and even death, okay? So this is an example of diarrhea, this one, okay? Now, this is an example of diarrhea. Have you had diarrhea before? Have you had diarrhea before?
ไหนคนไหนเคยท้องเสียคะ
You have diarrhea before? Yes, okay. Diarrhea is not good, okay? Because กินมากๆใช่ไหม
อ่ะ
กิน
โรค
มาก
ต่อมา
You eat a lot and it's not good. You have diarrhea, okay? That's why it is important to eat vegetables, to eat healthy food so that you won't get diarrhea, okay?
โรคต่อมานะคะ โรคที่3 diarrhea ก็คือท้องเสียนะคะ เกิดจากการที่เรารับประทานอาหารที่ไม่สดไม่สะอาดหรือบางคนกินสุกๆดิบๆบางคนกินอาหารดิบๆก็มีใช่ไหมคะอาจจะเกิดได้กับทุกคนทุกเพศทุกวัยเลยนะคะ แต่ส่วนมากก็จะเป็นสำหรับคนที่รับประทานอาหารที่ไม่สะอาดนะคะ สาเหตุก็เกิดจากการติดเชื้อในการที่เรารับประทานอาหารไม่สะอาดหรือบางคนกิน spicy very spicy เผ็ดมากๆหรือเปรี้ยวจัดอย่างเงี้ยนะคะก็อาจจะเกิดท้องเสียได้ แล้วก็การที่เราท้องเสียหมายถึงการที่เราเข้าห้องน้ำไปทำไมคะตุ๊ดไปอุจจาระมากกว่า3 ครั้งนะคะถือว่าเราท้องเสียแล้วนะคะบางคนอาจจะมีอาการคลื่นไส้หรือว่าอาเจียนได้นะคะหรือบางคนเมื่อเข้าห้องน้ำบ่อยๆแล้วจะเกิดอาการอ่อนเพลียหรืออาจเป็นไข้ได้เพราะว่าเราสูญเสียน้ำในร่างกายไปเป็นจำนวนมากบางทีอาจจะถึงขั้นช็อกหมดสติและอาจถึงขั้นเสียชีวิตได้นะคะเป็นโรคที่น่ากลัวอีกโรคหนึ่งนะคะเด็กๆเพราะฉะนั้นจะทานอะไรต้องระวังนิดนึงนะคะโอเค
Okay, now how do you treat yourself if you have diarrhea? Okay, this is the medicine that you will take, okay? Drink oral rehydration salt by mixing 1 pack of it with a glass of water. Now, do you know oral dehydration salt? The one that you buy in 7-Eleven, okay? The salt powder, okay? The salt for dehydration, okay? Hydrate, okay? So you drink that and you drink a lot of water, okay? Because if you have diarrhea, most likely you will lose a lot of water in your system, okay? That's why One treatment is to use hydrate and drink a lot of water if you have diarrhea. Also, please go to the doctor, okay? Go to the doctor when you have diarrhea for 2 days. 2 days you have diarrhea, go to the doctor because diarrhea can dehydrate you and it will kill you, okay? If you don't go to the doctor, okay? Okay,
การ
that
รัก
is
ษานะ
very,
คะ
very dangerous. Okay, you will be dehydrated, and eventually, if that dehydration will be worse, you can be in the hospital. Okay. Now, how do you prevent having diarrhea? First, eat vegetables. Okay. Eat healthy vegetables so that you won't get diarrhea. Next, eat newly cooked and clean food. Always eat hot food, okay? Clean and hot food, okay? Next, drink clean or boiled water, okay? Always drink clean water. Do not drink in the sink, okay? Do not drink the water in the sink. Drink water from purified stations, okay? From water who are clean or who is clean, okay? Always drink clean water. Now, wash your hands, okay? Nam, wash your hands with soap and before you will go eat. Before you eat, you wash your hands. After you go to the toilet, wash your hands, okay? And last is keep your house clean, okay? Always keep your surroundings and your things and your house clean so you won't get infected by diarrhea, okay?
การรักษานะคะโรคท้องเสียถ้านักเรียนมีอาการให้ดื่มเกลือแร่เด็กๆรู้จักเกลือแร่ไหมคะที่เป็นซองสามารถซื้อได้ตามร้านขายยาหรือ7-Elevenก็มีนะคะให้ดื่มนะต่อ1 ซองต่อน้ำ1 แก้วนะคะน้ำเกลือแร่เพราะว่าจะเป็นการช่วยทดแทนน้ำที่เราสูญเสียไปจากการอุจจาระแล้วก็ถ้าเด็กๆเป็นแล้วรู้สึกว่าอาการไม่ดีขึ้นก็ควรจะรีบไปพบแพทย์นะคะการป้องกัน1รับประทานอาหารที่สดใหม่แล้วก็ปรุงเสร็จที่แบบร้อนๆอยู่อะค่ะแล้วก็สะอาดอันที่2ดื่มน้ำที่สะอาดหรือบางทีอาจจะนำไปต้มให้อุ่นๆก่อนก็ได้นะคะข้อที่3ล้างมือก่อนที่เราจะรับประทานอาหารหรือว่าหลังจากเข้าห้องน้ำก็ต้องล้างมือด้วยนะคะข้อสุดท้ายทำรักษาความสะอาดของบ้านเรือนของเราให้ดีนะคะOkay.
Okay, again, this is diarrhea, okay? This is likely will happen to you if you get diarrhea, okay? So this one, okay? This one, okay? Now, look at this. This is the end of our lesson. This is part 1 only, okay? Next meeting, we do part 2, okay? This is a long lesson, okay? So I am trying to keep everything for you so that it's not gonna be super long, okay? We will do part 2 next week, okay? Okay, and then after that, we will do some exercises and homework for you, okay? All right, we only have 1 minute left. Now, before we end, do you have any more questions? Do you have questions?
มีคำถามไหมคะใครเข้าใจโอเค
Did you understand? Okay, now before we end, I have one question. From all the illnesses that we discussed, what illnesses have you experienced? Me, I had diarrhea before. How about you? What did you have?
เด็กๆเคยเป็นโรคอะไรที่เราเรียนมาเมื่อสักครู่ cold
Who got diarrhea?
pink
Diarrhea.
eye diarrhea
Diarrhea. Oh, diarrhea. How about pink eye? Pink eye.
pink eye
Sore eyes. Pink eye. Have pink eye. And last, who had
cold
wait. The last is Cold. Who had cold? This one. Me. Okay, very good, students. So we understand everyone and we understand everything from the lesson. Thank you for studying with me today. And students,